I'm Kurt Fearnley. We've been brought together today by Teachers Health to talk about the importance of unionism in the education and also the nursing and midwifery profession. We have an incredible panel, and I think we should just jump straight into it. Helen, I'm going to start with you.
Oh, right.
I wanted to know what makes a powerful teacher. What makes a teacher that leaves the impact that every person who has ever spoken about what changed your life kind of points back and goes, that teacher then?
Well, obviously that teacher, the powerful teacher, has made a connection with a student in a way that the student remembers. And I think that's the simplest way I could explain it. It's the relationship. And I guess it depends on the student, doesn't it? The teacher might have encouraged and supported the student, or the teacher might have spoken severely to the student and carried a few home truths. But it's the connection. It's a personal relationship in a certain structure, in the learning structure.
Chris, do you think that relationship between a teacher and a student has changed over the years?
It has, certainly.
How?
Oh, I think society is changing, and the students are changing, and the parents are changing. Their whole outlook on teaching as a profession. They don't often take what the teacher's saying as the truth. And I think we're so bogged down with getting results these days with the students that we're losing that personal contact with them, which in the old days, as in teaching, we had that contact and that relationship with the students. But that's something that a good teacher will, or a powerful teacher will build with the students. Yeah.
Susan, I was going to say, have we changed for the better or the worse?
Well, perhaps not better or worse, but certainly absolutely changed. Lots of change for the better overall. If you look at, things about issues like class sizes, for example, and what that means for students and teachers being able to do their jobs. But more difficult because of the environments that we live in. As Chris said, it's a more challenging environment, I think, for teachers and for students. One that actually often challenges, having students challenge teachers because they also get their information from so many other different places. But a teacher who has an impact on their students, then that support that's around them is so important.
Gemma, the role that's changed, that I feel has changed quite a lot over the last 20 or 30 years, is the role of a principal. When I went through school, I think the principal was, their relationship with the parents was just a different dynamic to what it feels like it is today. When you were a principal, how did you see that role change?
Oh, I thought it was so helpful to have parents who had particular skills that they could contribute to the community. So whether those skills were in, for example, in music, if you had parents who had any musical knowledge, that you could have them involved in the school and supporting things like that. And just the willingness to be involved, because kids love having their parents. They just love having their parents show up or be involved, whether it be at the canteen or come and work in the classroom. So you could see how important that was for students. So why not encourage, parents into the school, whereas that was not the way it was years ago at all.
Really?
Oh, yeah, often, particularly in city schools.
They were dragged in, though, when someone was in trouble.
Well, there were principals who discouraged that sort of relationship because they were in control and they didn't want any helpful hints from parents about what they should do. But it is, there's so much ability and skills out there in community. Why not have that, as part of your school community? Why not have it contribute?
We mentioned class sizes, Marie, just a little while ago.
Yes.
And what's been the role of unions in the process that has been the reduction of class sizes?
Oh, the unions have been absolutely critical in the reduction of class sizes. It was the unions, the teachers coming together through their unions to put the powerful arguments about why smaller class sizes were in the best interests of the students, and that the teacher-student relationship was so much stronger in the smaller classes. I think without the unions, we would still be having class sizes the way Gemma spoke about before when she started with class sizes of 50. The campaigning was through the knowledge the teachers had about the value and being able to persuade the community and then persuade the government.
And it's so important to the learning of the students, because when I first started teaching, you had to teach all 54 or whatever as being the same in their learning. Well, that's not how it is, as we all know.
Especially when there's a variation of learning that needs to be met, like disability, right?
Yeah. And I think too, the brighter students in the class will always do well. But in the larger classes, it's the bottom end, the little tail end there, that teachers need to spend more time and put more effort in to bring them up to speed. And that's what they miss out on in the larger classes.
Yeah.
Brett, what do you see as the shared experience between the unionism or the collective bargaining for teachers and also for nurses and midwifery?
Well, essentially, we're on the same path. Nurses and midwives are fighting for safer workloads. They want nurse-to-patient ratios on a shift-by-shift basis. Midwives want the same thing, particularly in the postnatal area where they're looking after mothers and babies. And as we understand it, teachers are wanting safer workloads, productive workloads, better pay and conditions. We have both a shared problem with retention of nurses, midwives and teachers. And that is a result of governments really taking for granted our professions as ones where they'll just keep soldiering on. They'll just keep putting up with poor conditions and poor pay. And until governments and employers realise that that has got to change, then we're going to have this cycle of new graduates come in, experience really atrocious workloads, and then leave and look for a better paid job or at least a less stressful job. Health and education are fairly high stress jobs because they're all about people. So that does take a special type of person who really can relate to other human beings and put aside their own discomfort for the benefit of their patient or their student.
Susan, I find that interesting because there is going to be a real need for the retention of staff in these two industries, and they are both incredibly powerful parts of our community. How are we going to retain teachers, nurses, midwives?
Well, it's a dual problem, of course. It's retention, but it's also recruiting new, because in both areas we know that we've got massive shortfalls and it's only going to get worse. It's interesting that, when I think, if I think about teaching, in previous decades, teaching has been a job that has actually provided security of employment. And now there is a far greater tendency for governments to employ people insecurely on contracts. And we know that we've got teachers, right across the country. It's worse in some states than in others, where teachers, new teachers come into the profession and 5 years later they're still on contracts. They still have no permanency. They still have no certainty in their jobs. And this is one of the ways in which we must improve if we are going to retain teachers and also recruit teachers, because, why would young people or, mid-career people come into teaching if they can't find secure employment, because everybody needs secure employment. So I think that that's one of the issues that we must tackle very quickly if we're going to retain, as well as all the obvious ones which are so clear in the community now, and that is the issues of workload and also the pay for teachers, that they must be addressed as well.
But Kurt, I think it's also about the political interference in the professional work of people. So, for example, in teaching, teachers feel that they are being told what to do when they are the professionals. They know what is best for their students, and yet they're being directed to do other things which they don't necessarily think are the best things. So it's about government stepping back and letting professionals get on with what they do best.
Or at the very least, inviting them into the conversation about where they believe change needs to be.
Might help.
Yeah.
Marie, on that, a new teacher graduating today, what's the importance of unionism for that new recruit?
Well, I think, one, it's about the respect and camaraderie that you get from your colleagues coming together for a purpose, and the purpose is about your profession and what you do for a living. So it's listening to others about that profession. The union is also important, of course, because it has your back. When you start in a new profession, you might have some uncertainties, you're not sure what might happen. Those around you will help you and guide you. So there's the guidance that the union provides. And then there is also the uplifting times that you are involved with the union, and you realise that you can effect positive change. And that's exciting as well.
Chris, what do you think the future role of unions is going to be?
Well, in education, our recruitment over the last few months has been phenomenal. We've had thousands join the union this year because they want to be part of the movement and to get better pay conditions. And I mean, for teachers, it's an insurance policy, really. They need to have that reassurance that if anything goes wrong, there's always going to be someone there that can step up and help them.
I think that teacher unions also have an important role to play in the professional growth of teachers through new educator networks, through offering professional development to new educators, bringing people together. But I think that being very clear about how we can help teachers become better teachers is a very important role for unions.
Helen, why do you think there is a push? Well, why do you think there is greater interest in joining a union at the moment?
Well, I think it's a couple of things. The unions are stepping up. They're speaking out. The members of the unions, they're in the streets, they're in rallies, they're protesting, and they're visible around very positive causes. And I think the communities generally can understand that. And I think Susan made reference a lot earlier to the issues around the public purse. Governments have attempted to depress wages for nurses and midwives, and also teachers. People in the community, and certainly the members of the unions, see through this. And that's a good thing.
Brett, what are some of the changes you've seen in nursing and midwifery over the last decade?
In 2002, we finally won a proposition called a reasonable workload in our public award. And that was really the start of being able to work more on the issue around workloads. It also occurred at a time when we were in pretty serious shortage. Nurses and midwives were overworked. They were saying, stop telling us to cope. And ironically, 10 years on, we're back to having to tell the government to stop telling us to cope and fix the problem. So that whole issue around the professional obligation to deliver safe patient care cannot be done if you do not have enough nurses or midwives to look after the patients. And change in healthcare has occurred as well. so that people in hospital are far sicker for a shorter period of time that they're in front of the nurse or midwife. Mothers and babies leave hospital in a very short period of time after delivery. So there is a very small window for midwives to assist those mothers and babies to get ready to breastfeed, to commence breastfeeding. And that's a fundamental obligation that we should have to assist new mothers to be able to feed the next generation appropriately. And the failure to have enough midwives there to look after the new mothers and babies has a consequence for the lives of those babies and their mothers and their families. But also in the general or surgical areas. The failure to have enough nurses there ready to detect a deterioration means that people have worse outcomes. And the nurses suffer that. They go home every day feeling like they haven't done what they're professionally obligated to do. That's why they will not give up on the campaign for nurse-to-patient ratios, midwifery ratios. And if the government won't listen, they've got no choice but to be union, to be loud, and to advocate strongly to the community to say we need change, and that's what the union is there to do.
Gemma, I want to talk about the role the union does to change the country. What does it do on the bigger scale when it plays its role in not just the intricacies of what it is to be a teacher or a nurse or midwife, but how does it impact the country as a whole?
It contributes to the betterment of the whole of society. So if you think about what the unions have gained over the years, it's not just for the individual members, it's for the broader society. And unions have usually been way ahead of in their thinking about what is better for the society. And so I think they have, in education, I think back to when I started teaching and what teaching is like now. Well, the recognition of the needs of students is enormous now compared to what it was, many decades ago, in that students' needs and individual needs and differing needs are acknowledged. And that's what the sort of thing that unions have fought for. It hasn't just been for what their members need, but it's for the betterment of students, of patients, of the whole community.
I also want to add, I really like it when the unions can also say, because they're often at the forefront of the thinking for change, like the climate change movement. But when the students were taking the lead in that area, and I loved it how the union said, we support that, we totally support that, but we're behind you, we're not in front of you. We're supporting what you do. And I think that's a really important role for unions as well, where they can see that there's positive change and they can support in that way.
And when you look over the years about the positive changes that have happened in Australia, in our society, in our communities, it actually mostly has been because of unions and union members collectively coming together to fight for them. The right to a safe workplace, pay equity, which we still, of course, haven't achieved, paid maternity leave, just having annual leave and sick leave. They are things that unions have fought for and unions have achieved. So, yes, unions do play an incredibly important role in the broader community.
Helen, what does it mean to be a part of teachers' health and nurses and midwives' health?
I think security of mind. You know that you can get help when you have a health crisis or someone in your family does. But I think it's also the service that we as members can access through our healthcare centres, the eye care centres, the dental services. That's very, very valuable to people. It's about the sense of protecting your health.
And also the way Teachers Health encourages you to be proactive in your well-being. So, I access a number of professionals who help me stay well. Very helpful.
And it is a community that seems to put a lot of itself out, yet sometimes can be at the individual deficit or like there is so much energy placed into the workload of today that it often comes at a cost. How important is it, Chris, for Teachers Health be acting for the well-being of teachers?
Well, I think in the changing world of teaching at the moment and the workload, stress is a big thing amongst teachers. And Teachers Health, I know that I've used it constantly over the last few years, and I know that if I have to go into hospital, it can be done next week. I don't have to get on a waiting list. And I think just having that reassurance that they are there for you, I feel comfortable, that I've got that backup with them.
How about nurses and midwives? How it's been a pretty challenging couple of years for every industry, but the health industry seems to be one of the most challenged. Why is it important to have access to the nurses and midwives' health?
Well, of all people, nurses and midwives know how difficult it can be to navigate the health system. And they want to make choices about their own healthcare. It's often, fairly critical for them that they get service as quickly as possible so that they can get back to work. So there are lots of reasons for nurses and midwives to be able to make those choices, and they can do that through private health insurance, through Nurses and Midwives Health.
I want to ask everyone this one, and I want to go back to make it a more personal conversation about what is the biggest impact that you've seen through teaching.
In so many countries where governments have worked together, governments without many resources, but other governments that come from countries with resourcing working with them, where education has actually changed a country's direction. That children who never got a chance to go to school actually now go to school because of that collective effort across the globe. And through education and through teaching and teachers have actually changed not only individual students' lives, whole families' lives, and in fact the direction of countries as well.
I just changed 6 times about what story I would tell because of that. I was trying to think about how I would answer it. And I thought as a child, being the recipient of a teacher who changed my life, who defined me as valuable, defined me in a position of power just time and time and time again, often, so far away from the work that they would do in the classroom, more on the human to human, the personal kind of interaction. And then I just went through as a teacher, and then I went through seeing a kid with a disability getting their first day of education as a teenager. And that, spark that is happening abroad because of a wonderful teacher who donated their time to go over and change this kid's life. Look, I'll open it up to anyone who, what are moments in your life that you've seen the real spark, the real change-making moments that teachers bring?
I recall teaching in country New South Wales, teaching English, HSC, and we bundled the students up and we took them over to see Shakespeare in Wagga Wagga, and it was just amazing. I know that seems small in the scale of everything we do as the unions, but it was just an amazing experience for them to experience theatre in that way. They did very well in the HSC, and I think it's because of the spark of understanding. This is what Marie's been trying to get over to us, that there's something exciting about immersing yourself in that theatre. So that's just one small experience from a long time ago. But a lot of the students had never had the opportunity to see theatre in that way. And it's not easy to teach in those circumstances where you haven't got the resources you've got in a city.
I think for me it was working with students who are refugees from war-torn countries, many of whom had had no education whatsoever. And we were able to provide that initial education that set them on a path that enabled them to then do what they wanted to in life.
Yes, I think looking back over the years, just having students in your class with troubled home lives and come to school every day to try and do their best, but in the back of their mind is what I'm going to go home to, and to spend that time with those kids and then to see the smile on their face when they receive their HSC because that teacher told me I could do it. And the union has to play a part in the equality because as in our situation, we've got, and most, I think, about 75% of our members are female and you've got males at the top. So there has to be a change.
Brett, what about in nurses and midwifery?
There's an interesting history in nursing in relation to when the union was formed. It was a generalist nursing union and there was a separate mental health union. The mental health union was being run by a man, and when those two unions joined together, the female leader of the nurses stepped back and gave over the position to the man who ran it for 22 years, uncontested. Then he was followed by many very strong and powerful women. The nursing culture, I suppose, was a bit different to teaching. It was obviously led in the main by women. There are disproportionate numbers of men who have got into more senior positions. But in nursing overall, when I joined as a student nurse at Royal Prince Alfred, it was made pretty clear to me that males were only 8% of the workforce. And we've progressed to about, at best, 11.5%, 12%. So there hasn't been a lot of change in 40 years. So all of those dynamics are still at play. But ultimately, we suffer as a profession, both nursing and midwifery, is that it has been seen as women's work. And right across caring and teaching, we've got a long way to go in the society about recognising the value of that work. The culture of the union has changed. It's much more inclusive, family-orientated, younger people joining the union as organisers, coming in to work for the union than when I started in 1990.
Yep. Well said.
Susan, what are your hopes for education and healthcare in Australia?
Well, my hopes are that we are able to properly fund through government revenue, health systems and education systems which provide for all, regardless of background, circumstance, etc., wealth, anything else. I think that that's where we should be heading. That's where we want to be. And it really does rely on governments to be able to provide the funding and revenue necessary to do it.
Can we ask for world best when it comes to education and healthcare? Is that a conversation that takes place at all or should take place?
Yes. Yes, it has to be a conversation that we continue to strive for. That
world's best.
Why not world's best?
Yeah.
We are fundamentally a wealthy nation, and we would be even better off if we had a well-educated, very healthy workforce. COVID showed us that your economy is nothing if all the workers are locked at home or sick. So, you know, if society has had a wake-up call about the imperative of both health and education, then COVID must have shown them that. And it's certainly continually important for unions to say, hang on a minute, those people that were fundamental to the survival of our society and our economy are actually not the people pushing the dollars on the calculators. It's actually the people delivering services, and we need to make sure that we've got enough people doing those jobs and that we look after them, and that we actually say to our kids, these are critically important jobs in our society. Our society doesn't work without the fundamentals of health, education, and welfare. We need to look after those that cannot look after themselves.
Right.
And education is obviously the core to being able to do all of that.
Agree.
So it's the political commitment for our country to have the best possible. Education, health.
Yep.
And equity in education and health. That commitment to that.
Yeah.
Yeah, because I always sort of
deserve
I
it.
shy away from the world's best a little bit, only because I absolutely agree we're a very wealthy country and we can afford the best.
Yeah.
But it's how you define the world's
Yep,
best. And
that's right.
in education, we've had some bad experiences with that because, you know, the challenge is how do you compare yourself with other countries, and that brings in a whole discussion around, you know, standardised testing and competitiveness and so on. But I you know, that's it's a different discussion, I think. The question about whether we can afford it and whether we should be striving for the best there is no question.
Yep.
We should.
That's why I wasn't sure whether or not we could throw that line there. I'm used to, when it comes to disability services, whenever I hear value for money, I grit my teeth because who's setting the value?
Yeah, exactly.
When it comes to the lives of somebody
Exactly.
with a disability, like when we said equity or equality, we can't have well best without equality.
Yep.
You can't say value for money without the voice of the person who is the who is the at the crux of it being able to be heard.
Absolutely.
I'll just finish on one question, but it's for everyone and across industry. What would you tell for the person on their first day, whether it be education or nurse and midwifery? What advice would you give them this very minute? And I'll start with you, Marie.
Okay. So for a new teacher starting, I would say to them, enjoy working with the students, the hope and optimism that there is every day. And in saying that, I acknowledge the intensity of the workload, but that optimism and that hope, it's fantastic, particularly for a new teacher, I think. I would also say to them, join your union if you haven't already done so, and make sure you become actively involved so you can change the world for the better, but also your own workplace. And finally, I would say to the new teacher, look, always aim to improve your teaching practice and your professionalism. Don't go in and think, look, you know, after say 5 years, I'm a good teacher now, and you probably are, but you can always improve that practice, and that's what I'd say.
Have fun.
That's hard to do.
Have fun.
But
That's pretty good.
Have fun. Oh, yes.
Have fun with your
That's big.
students. Have fun with your colleagues, and stay focused that students and their learning and their well-being is what you're about.
Yeah, that's great.
And I think also to add to those, because I think that's right, be proud.
Yeah.
You know, be proud of this profession that you've joined,
Yeah.
because it is a wonderful profession, and you can bring about much change for people. And so, you know, enjoy, be proud, do all of those things.
Maintain the passion.
Yeah.
Because most young people go in with great passion, maintain it.
How do you do that?
Through finding what works for you to keep reinvigorating you.
Yeah.
And that will be different for different people. So for me, I mean, it was really important to be in the union and work with my colleagues on different projects, you know, within the union. That kept me buoyed.
Yeah.
Don't be afraid to ask for help. Talk to people. Be open if you're having, or you think you're having a problem. Be open and ask for someone to help you. And I mean, that way everyone's always there to help and assist. Yeah.
I've always loved a good campaign. Join.
Join the union, yeah.
So I'd say to a new nurse or midwife, convert your associate membership to full membership. And this is a great profession, or either nursing or midwifery, or do both. There are at least 70 different specialties to work towards. The choices are so varied, and if it's not hospital, it could be community, it could be industry where you end up working, it could be doing anything related to health. And the opportunities will be great, but you will go through some tough times, and that's why union membership is absolutely essential, so that they've got your back and you can be part of the collective that needs to change what you experience, because we all know it doesn't matter which job you go into, it's not going to be perfect. There is no perfect employment unless you've defined it yourself and you're managing it yourself and you're wealthy. That might be perfect, but that's not going to deliver what you can do in nursing and midwifery. And you're going to help people. You will get reward from what you put in, whether it's to the individual patient, whether it's to the families of patients. But whatever you do, keep your faith in the decision you made, that you want to be part of a profession that is all about facilitating other people's well-being.
Lucky last, Helen.
Well, I love every comment I heard, but I guess I'm thinking about those first few years, and it seems to me, regardless of where it might be in the city, or it might be in a regional town or hospital setting or school, the thing that I think is most important is that you're not there by yourself. You're there, and in and out of the workplace will come a whole range of people, and some of them you'll be reporting to, and others will be they're your colleagues, they're your professional colleagues. And I'm thinking that you should never leave work, go home with a problem that troubles you, where you don't have a means to talk to a colleague about the problem. These professions are collegiate professions. We work in teams. And so that means you should never be isolated, and never drift into a kind of isolation about your work and the issues that you might be confronting.
Well, thank you. I think that's it. And that was a lovely conversation, and thanks for your time.
Thank you.
Thank you. Yes.
I'd like to thank the panel for your incredible contribution, and of course Teachers Health for getting us all together. It's been a wonderful session. Until next time, it's been great.